Hi, and thanks for your interest in this rotation. My name is Paul, and I'm a board certified clinical pharmacist working for Primary Care IPA, or PCIPA for short. We've been accepting APPE students at PCIPA for about 7 years now for both single AmCare rotations and two module longitudinal rotations. Let's talk a little bit more about the rotation itself. First, the IPA stands for Independent Physician Association. It's not a beer, unfortunately, but we have been toying with the idea of making our own label for the holidays one of these years. An IPA, like PCIPA, is similar to GLIN, that's where Dr. Slazak works, or Catholic Medical Partners, that's the Catholic Health System. The difference between those IPAs and PCIPA is that our offices are each solely owned and operated by the physicians who work there. Our IPA supports the practices, but all the decisions are made in-house by the providers without any outside pressure from a large hospital system or a health system. For comparison, you can think of PCIPA as a network or a union that supports the mom and pop stores of the healthcare world. Comparing to the pharmacy world, we're more like the independent pharmacies or the grocery store pharmacies, while the other IPAs in the area, they're more like the chain pharmacies. We, I'm sure like them, pride ourselves on excellence at all levels, mostly by supporting the quadruple aim, as you can see here in our mission statement. We basically want to provide excellent care to individuals and populations at affordable prices with good work-life balance for staff. Anything that the IPA can do to support that quadruple aim is something that we'll take a look at and help our doctors with. For PCIPA, we have around 25 practices in the network and around 100 physicians supporting about 150,000 patient lives. Most of our offices are clustered around the Buffalo North towns, but we do extend north into Niagara County, south to the South towns, and even down into Chautauqua County. For you, our students, we don't want to make you travel too far, so you'll be based mostly out of the north towns. You'll have access to some offices down in Chautauqua County, though, because I find it very important to give you lots of experiences, and there's nothing quite like a rural population for a new experience. Those ones will be remote, though. We'll talk about that here in a minute. So, of those practices, we're going to get you into three of them. Remember, each is independent and somewhat unique. The first practice that you're going to look at is called Westfield Family Physicians, which serves the northernmost county in the Appalachian Mountain System. Very rural, which has unique health considerations, things that you don't often see around Buffalo. For example, they have no access to specialist care for many specialties. A person living in Jamestown, New York, Chautauqua County, is about 2 hours away from Dent Neurology, and yet they'll go to the same neurologist at Dent that you or I would coming from Amherst. Similarly, there are no endocrinologists in Chautauqua County at all. So when we're working with patients for diabetes, we're performing many of the functions that the patients would be getting from an endocrinologist. They just can't get to one. Second practice that we look at for our students is called Highgate Medical Group. This is the largest practice in our IPA, providing care to tens of thousands of patients and utilizing a large interprofessional team. That means you'll get the chance to interact with physicians, physician assistants, nurse practitioners, care managers, social workers, all sorts of different team-based approaches. The third office is Kenmore Family Medicine. This is a medium-sized office, and they really pride themselves on developing close patient-provider relationships. Just as an example of what that looks like, this last week I had two patients. One brought me in a vase of flowers that they had cut from their garden. Another brought me in a freshly baked tin of cookies, just to say thank you for the great work that we were doing. All of our offices, no matter how big or how small, again, seek to provide that exceptional preventative patient care. Remember, we are not attached to a hospital system, which means that we can intentionally reduce hospitalizations. That leads to primary care facilities that can provide top tier care across multiple quality metrics. So, who are you actually going to be working with? Mostly me. I'll be your preceptor. Again, my name is Paul and I'm a pharmacist. I have about 3 years of experience with precepting at this time. Most interested in diabetes and respiratory management sort of concerns for myself. You'll also see two other folks in the IPA as auxiliary preceptors. So, Rob Bennett has been doing this since 2019. He even taught a few courses at UB in smoking cessation when I was there as a student, and also an ambulatory care pharmacy course that he ran for a few years. He's our director of clinical services. If you went to the business school a few years ago, you might have run into Larry Zielinski. He was a former associate professor in the School of Business and Management. Students interested in the business aspect of pharmacy have taken advantage of the option to work on projects with Larry. Most of the work that we do is going to be direct patient care. A large portion of that is diabetes medication management, similar to what Dr. Albanese does at her rotation. Rob and I both trained at Buffalo Medical Group after all. You can expect to dive deep into learning about and managing patients with continuous glucose monitors, insulin titrations, complex medication titrations, diet and exercise, the whole gamut. And after you show that you're competent in the area, we let you out and do that on your own with minimal supervision from the preceptor. So you really get to dive deep and get to know your patients on your own. You also provide more than just diabetes education, though. We do a comprehensive service that extends out to most other chronic disease states that are managed by medications. Students at PCIPA have run hypertension clinics, osteoporosis clinics, weight loss clinics, smoking cessation clinics. Had a student that was interested in doing a PrEP seminar. Any kind of disease state that you're interested in that has a chronic disease attached to it, we can usually find a way for you to explore that interest. But it's not just individual disease states that we're addressing. I want to remind you that we're doing whole person care here. That means that we're doing comprehensive medication reviews on purpose to look at not just one disease state, but the whole person. Then, most importantly, in my mind, for an APPE experience is something that's better practiced than taught or learned in the classroom. That's motivational interviewing skills or interprofessional communication skills. Lots of opportunities here at PCIPA to learn how to interview patients, motivate patients, and talk to your team. This is important to prepare you for any future career, whether you want to go to an AmCare or not. We also do lots of other projects like value-based care, cost savings opportunities, educating COPD patients to reduce exacerbation risks, things like that. So, what do you get out of this rotation? We already talked about managing chronic disease states and outpatient care. This is a great opportunity for residency prep. Most AmCare pharmacists are residency trained and go on to be board certified. This gives you a glimpse into what that looks like. But most importantly to me, other than that motivational interviewing piece, is that you're going to get to see multiple different types of patients here. Patients that cross the rural, suburban, and urban demographics, patients with all sorts of health literacy issues, patients as young as 18 or as old as 97. I have a 97-year-old who walks to his appointments with me still. You're going to see multiple cultural, ethnic, and socioeconomic backgrounds. I have multiple families that come to me from Amish communities or inner city urban Buffalo communities. For logistics on this rotation, we're looking at a mixed format. That means a few days a week you'll be in person in the Buffalo North towns to provide direct patient care. And then a few days of the week, if you want to take them, you can be remote. Technology and resources are all provided. There's free parking, of course, and usually about once a week, we also get a free lunch. Thanks again so much for showing interest in this rotation. Looking forward to hearing any and all questions that you might have. Please feel free to get a hold of me. And again, we're hoping to see you at Primary Care IPA for a longitudinal rotation next year.